Memorial Health is part of Mayo Clinic's National Plasma Program. Patients who have recovered from the novel coronavirus that causes COVID-19 have antibodies in their blood that can fight the virus. A donor's plasma can then be transfused into a COVID-19 patient who doesn't have that immunity yet.
They use convalescent plasma to treat people fighting off the Spanish flu, and it was found to be helpful in those situations. With COVID-19, the data are not in yet, and that's why we're participating in the study to help gather those data.
Dr. Leslie Bacon, an infectious disease specialist at North Memorial Hospital, says they plan to enroll as many COVID-19 patients as they can. Mayo Clinic says so far statewide about 40 sites are involved, but they need plasma. For example, a Maple Grove couple is signed up for this treatment, but family says they're waiting on donations.
We have received plasma from the East Coast where COVID-19 has been affecting the population for many months now. Hopefully, as we gain more people in the Midwest who have recovered from this awful disease, we'll be able to offer them the opportunity to help others recover.
We've heard from recovered COVID-19 patients in Minnesota who want to donate but can't get a test to confirm their diagnosis. As the state expands testing, that should change.
That will allow more people to who want to give to be able to give.
In Robbinsdale, Heidi Wigdahl, KARE 11 News.
Well, the American Red Cross says they have not collected any convalescent plasma in Minnesota yet. If you want to donate, you do need to have a verified COVID-19 diagnosis. We have much more information on donating at KARE11.com.
Well, Derek.